Hi friends, good evening. Once again, welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for ESIC, RRB, DSSSB, AIIMS, NORCET, Kerala PSC, DME, JPHN exam. In the previous video, we discussed questions from pharmacology. Today also we can continue pharmacology questions. First question, drug used for the treatment of pediatric AIDS. Options, option A, procaine penicillin, option B, nevirapine, option C, azithromycin, option D, acyclovir. Question, which among the following drug is used for the treatment of AIDS? AIDS means acquired immunodeficiency syndrome in pediatric case. And the correct answer is, it is nevirapine. Option B is the correct answer. The dose of nevirapine we can see, a dose of 200 milligram is given daily for 14 days. First 2 weeks 200 milligram daily. Then after that the dose is increases to 200 milligram twice daily. Okay, that is BD dose per day. This is the usual dosage for pediatric, but the doses varies according to the weight of the child. Okay, this is the recommended dose, but the doses varies according to the weight. The next question, which drug is given to prevent HIV transmission from mother to child? Options, option A, stavudine, option B, azithromycin, option C, nevirapine, option D, lamivudine. Question, which drug is given or which drug will give to the mother to prevent HIV transmission from mother to child? And the correct answer is option C, nevirapine. Nevirapine is an example of antiretroviral agent. Its peculiarities, it is a non-nucleoside reverse transcriptase inhibitors. This drug is mainly inhibiting the HIV virus, and also it is more potent than cidovudine. Cidovudine is also an antiretroviral agent. It is mainly helps to prevent a replication of HIV virus. And the next question, which of the following is a shortest acting local anesthetic agent? Options, option A, lidocaine, option B, procaine, option C, bupivacaine, option D, amitrocaine. Here the question is, which local anesthetic agent is shortest acting? Shortest acting means it's act fastly or it act quickly after giving injection. Okay, and the correct answer is, it is procaine. Option B is the correct answer. And the next question, antidote for morphine is? Options, antidotes are important area. Okay, options, option A, N-acetylcysteine, option B, protamine sulfate, option C, naloxone, option D, warfarin. Here, which is the antidote of morphine? And the correct answer is naloxone. Option C is the correct answer. Some of the antidote related questions based on the previous year question papers. We can see heparin antidote is protamine sulfate, and paracetamol antidote is N-acetylcysteine, warfarin vitamin K, and atropine physostigmine, insulin glucose, oral glucose or sugar we can give, iron dimercaprol, and mushroom poisoning it is atropine, and organophosphorus poisoning also atropine sulfate. Here in our question, antidote of morphine is naloxone. Move on to the next question, which of the following drug cause ototoxicity? Options, option A, tetracycline, option B, penicillin, option C, chloramphenicol, option D, aminoglycosides. Ototoxicity means damage to the ear or inner ear, that is toxic to ear, that is ototoxicity. So here the drug which may cause ototoxicity is aminoglycosides. Option D is the correct answer. And the next question, digoxin is administered intravenously to the patient as the drug active. Options, option A, dilate coronary artery, option B, increase myocardial contractility, option C, decrease electrical conductivity to heart, option D, decrease cardiac dysarrhythmia. Here the question is, what is the action of digoxin? Okay, digoxin is given intravenously. The main action, this digoxin is an example of cardiac glycosides. This produces positive inotropic action which helps to increase the force of myocardial contraction. So here the answer will come increase myocardial contractility. Option B is the correct answer. And an important point, therapeutic dose of digoxin is 0.5 to 2 nanogram per ml. And above this level, 0.5 to 2, this is the normal dose. Above this may cause toxic to the patient. Also an important point, this digoxin is contraindicated in case of ventricular dysarrhythmia and second or third degree heart block. Move on to the next question. Diuretics which can cause ototoxicity is options. Option A spironolactone, option B acetazolamide, option C furosemide, option D all of this. Which diuretic cause ototoxicity? And the correct answer is it is furosemide. Furosemide is an example of loop diuretics which can cause ototoxicity. Move on to the next question. Which of the following drug used in HIV positive patient to control the progression of AIDS? Options. Option A acyclovir, option B zidovudine, option C azithromycin, option D gentamicin. Here the question is, which drug is used to control HIV, rapid multiplication of HIV virus in AIDS patient? Okay, so answer will come zidovudine, option B. Okay. Zidovudine is an example of nucleoside reverse transcriptase inhibitors. This mainly helps to prevent the multiplication of HIV virus in AIDS patient. Zidovudine or lamivudine or stavudine all are nucleoside reverse transcriptase inhibitors. In the previous question or first and second question we discussed nevirapine. Nevirapine is used to given in pediatric case also we can give also to prevent transmission of HIV virus from mother to baby. That case this is nevirapine is an example of non-nucleoside reverse transcriptase inhibitors. This is mainly inhibiting the HIV virus. Okay, here this rapid multiplication we can prevent usually by giving HIV positive patient we can give zidovudine. And the next question, side effect of antiretroviral drugs zidovudine include options. Option A neutropenia, option B nephrotoxicity, option C ototoxicity, option D splenomegaly. Which is the most common side effect of zidovudine? And the correct answer is it is neutropenia. Neutropenia means decreased neutrophil count in the blood, that is neutropenia, reduced or decreased neutrophils count in the blood. The common side effect of the zidovudine include nausea, vomiting, anemia, leukopenia, especially neutropenia, and also myopathy, then fatigue and headache. And the next question, which of the following drug is administered sublingually for the management of angina pectoris? Options. Option A aspirin, option B nitroglycerin, option C warfarin, option D atenolol. Here the question is, which medication is given sublingually? Sublingually means keeping under the tongue. Okay, for the management of angina pectoris. Angina pectoris, angina is a chest pain resulting from myocardial ischemia. Here the question is, which drug or which medication is given sublingually for the management of angina pectoris? And the correct answer it is nitroglycerin. Option B. Nitroglycerin is an example of anti-anginal medication. Anti-anginal means it is mainly to relieve chest pain which is associated with cardiac ischemia. Okay, before administering this nitroglycerin, as a nurse, we have to check the characteristics of pain, how the patient is experiencing the pain. Also, we have to note the heart rate, rhythm and blood pressure. While giving the medication, we have to stay with the patient, and one tablet for every 5 minutes interval we can give. That is for 3 dose, subsequent dose we can give to the patient. After giving the third dose, if the pain is not subsided, means immediately we have to notify the physician. So while giving this sublingual dose, we have to instruct the client not to swallow the medication. It should be keep under the tongue. That we have to explain. Also, we have to explain the client to store the medication in a dark, tightly closed bottle, because this nitroglycerin is an volatile. It can evaporate itself. So, we have to close tight container we have to use to store this medication. That also we have to explain to the client.